Well, good morning. It's Nancy today. Well, we are driving to Willem's post-cataract surgery appointment. Now, Willem, a lot of people are scared of having cataract surgery. They think, nobody's going to cut my eye with a knife. Do you have anything to say about that?
Well, I was a little apprehensive too, but it's quite a routine thing, and there is some annoying discomfort sometimes right after, but it's not really anything too scared about. The only thing you have to be very careful about is to do all the things the doctor tells you to do, and not do the things that the doctor tells you not to do, so that it will heal properly. That's about it.
So what does the doctor tell you to do?
The doctor tells you to take these pills so many times a day.
Pills?
Sorry, eye drops, thank you. Yeah, so you have to be careful taking them the right way and the right time, and not to put pressure on the eye, because two dangers after the operation are infection and the lens that they put in shifting. So you should not put pressure on your eye, you should not lift heavy objects or do very strenuous work. That's all it. The most annoying thing about it is not being able to drive, and my sweetheart has driven me everywhere I need to go. Thank you, Nancy.
You're welcome. Now, you said that after the operation, first of all, let's go back. So during the operation, do you see anything?
You see just light in general. They put all sort of stuff in your eyes, some gel and all that sort of stuff. And you can't see the surgical equipment that they use to put into your eye. You just see light in the middle. You can see a little bit the periphery. You can see the doctor's face and part of his gown. That's it.
Because that's on the periphery.
Yeah, I could see that. But right in front of me, I could just see light. Sometimes bright light, bright.
You know, I remember having an operation and being able to see reflections in the doctor's glasses. Or maybe I was seeing, maybe this was getting my teeth done. Yes, getting my teeth done. I could see the reflections in the dentist glasses. Okay, so you said now that after the operation, it was a bit annoying?
Yeah, especially the second eye. I don't know why, but it was nothing really major. Ibuprofen and Tylenol will take care of it. There's a bit of redness on the eye, and you can feel the beginning. You can feel the lens sitting as it sense it as a foreign object. Every time you move your eyelid over them, you might feel it. That goes away quickly.
Okay, so now right after so during the let's start at the beginning. So the day before, and you start doing drops, and then
2 days before.
2 days before you do drops, and then you go to the hospital, and they what? Look at your they keep putting drops in.
You should fast the night before, no solid food after midnight, and only clear drinks up to 2 hours before the operation, and not too much, so they don't want you to have a problem with the washroom when you operate it, I guess. So that's that. And then I pay for my lens. I had a special lens that the provincial health plan does not cover, but fortunately my Health Canada plan, my employer's plan, does cover it for about up to 80%, and so I pay that, get a receipt, and the cashier bring it with me so they know that I've paid for it.
Okay, and then you get eye drops. They put 4 drops in your eyes.
About four eye drops 3 times. Usually, you get 4 eye drops. You wait 4 more. I didn't really count, but I think it's about 4. And then I wait again, another 4. That takes a long time, so I have to be there 3 hours. Even though the operation takes about 20 minutes or so. Then they asked me to. They also asked me to take to undress on the top, from the waist up, and to put a gown on. And what else?
Okay, and so then they put you on the stretcher.
On the stretcher.
And then you. So now, just before the operation, do they give you a needle or anything to numb the eye, or is that the purpose of all the eye drops?
The eye drops numb them, and they dilate the pupils and do whatever other things they do.
So that's the way that you have no pain and feeling, is because of the eye drops.
I think so. Yes, the eye drop, the freezing eye drop is numb. Yeah.
And so you're also a little bit woozy, just a little, right?
They do sedate me, although I do remain conscious, because they do ask me to look this way or that way sometimes during the operation. They can better get at it, I guess. And then, but I am, sort of sedated. They give me something intravenous.
Okay, and so then after the operation, you go to a recovery room?
Yeah, and they just sit there for about half an hour. They let's lie down on a stretcher for about half an hour, and then sometime during it they gave me a light snack, I think a muffin and a drink.
Ginger ale.
Ginger ale. There was a choice of several, but I like ginger ale. And then you're told to go, get the clothes back on. There you go.
And then I pick him up. And they won't let him out until I'm there to pick him up.
Yeah, if there is no driver, I have to make sure that I have a driver. And if they don't get one, then they won't operate. They'll cancel the operation for the day. And a taxi is not good enough for some reason, for some legal reasons. There has to be somebody personal to drive you.
That's interesting, isn't it? And then when he got in the car, and after I picked him up, it's as if his tongue was loosed. He was a little bit different. He would just say the things he thought, which was really cute because he doesn't usually say everything. He's very quiet. And so he would say little things. He'd make little pokes at me. It was very fun. I liked it. Did you notice that you were doing that with him?
Yeah.
Anyway, and so then last night, when he was at home, well, first thing we did, we stopped and got him some reading glasses, because since his both eyes had been done, now they put in your prescription. So instead of it being in glasses, it's now in your eye. And so now you need reading glasses, because...
It's amazing. I can see pretty good now, far. You know, it's pretty well perfect. But I couldn't read my iPod anymore. No matter what distance I held it from my eye, it's always blurry. So...
That's because he was as if looking through the upper part of his... bifocals. So we stopped and got him some reading glasses at the dollar store, and a lot of places they were $1, but we got them at Canadian Tire just because that's the only place that we could go in and out of quickly on the way. And it cost us $15. They must be better, obviously.
Of course.
It must be of higher quality. They look identical, but they must be higher. Okay, and so then we came home, and he didn't do lifting, but he went instead, he played the piano. He doesn't need his eyes for the piano. And he...
Yeah, I do.
You do?
I need my eyes on the piano, yeah, absolutely.
Well, you were able to play it in the dark during the ice storm.
Yeah, but it was not perfect.
Oh, so he made mistakes. I'm sorry.
No, for some
he was not Anton Querty without his eyes.
Some easy pieces you can maybe do without light, but pieces where you have big jumps, I cannot do. Some people might be able to.
Easy pieces like Beethoven, Bach, Schubert, Schumann, Ravel.
Yeah, right.
You know, easy stuff. Okay, so he played the piano, and did you also work on your computer?
Yeah, a little bit.
And how did you find that? Usually when I see you at the computer, you're scrunching and trying to get very close.
I don't know yet.
I don't think you were doing that.
My eye was annoying me, bothering me a bit. And I could see properly. I don't think I needed my reading glasses on there. I think I'll be okay.
Alright, that's good.
If needs be, you can get some weaker prescription glasses just
for that distance.
Just for that distance, yeah. But I don't think I'll need them.
Okay, and then you didn't need to go to bed early. You didn't feel exhausted or anything.
Well, I was tired, yeah.
Oh, you were tired.
Tired.
Okay.
And I fell asleep pretty quickly.
And he took ibuprofen and Tylenol at different times.
I got, yeah.
You can take ibuprofen every 4 hours. That's Advil, or I don't know what the other names are. You can take ibuprofen every 4 hours, and you can take Tylenol every 4 hours. And they don't interfere with each other. So if you take ibuprofen and 2 hours later you take Tylenol or acetaminophen, then you do that again. And so every 2 hours you're having a pill. And that will keep you from having any reaction or any pain whatsoever. But it was just a slight bit annoying that this little foreign object was in his eye. So he took those and then went to bed. And at bedtime he put a patch. There's a metal shield they give you. And so he taped that on and went to bed.
Just to make sure you didn't poke your own eye with something accidentally. The pressure on the upper lip.
Yeah, so there you go. So that's the whole thing. And now today, how do you feel?
I feel okay.
You feel back to normal?
Yeah.
And you're wearing sunglasses because
the sun was shining pretty brightly into the
Now, I had a friend that just said that her doctor told her to wear sunglasses or else the cataracts would grow back. Did you hear anything like that?
No, the cataracts will not grow back. But it may be that your eye is still a little bit dilated, so you'll be bothered by bright sunlight right after the operation. So they recommend taking sunglasses.
And so how does your eye feel now?
All right.
Did you take Tylenol or anything?
Not anymore today, but I'm glad we have some ibuprofen in the car just in case.
Okay, and now today we're on our way to the doctor the morning after. And what is it we're doing today?
He's just going to check up and see how my eye is doing.
Okay. And then what do we do? A week or at the end of the week?
A week after today, we'll have another appointment. And then a month after, I think, I have another appointment. Because that's when the final, that's when an eye is going to be as good as it is from that point on. It takes that long to get to a stable state, and then we'll have a prescription if necessary, and that's it.
And it's at that point that you'll be able to drive again?
For sure, maybe even earlier. The doctor almost let me drive between the first and the second operation after a week, but he decided just for precaution not to do that, to see my optometrist. But of course he couldn't have an appointment ready very quickly, so there's no point, especially since the second operation was all of a sudden so soon after the first one. So all of a sudden it opened up, and the other eye was doing well. So
how long apart were they?
2 weeks. And normally it takes at least a month, and they put me in for 2 weeks.
All right. So would you recommend having cataract surgery to people?
Only if you have cataracts.
Okay. Well, you heard it here last. Bye.